Hello, it's my pleasure to welcome you in this special edition of You and Your Health. I'm Dr. Richard Okoye, and today we're going to discuss something that has been hidden from so many people, particularly with respect to sex and also pregnancy. And today we're going to discuss about the best sex position that guarantees pregnancy. Perhaps because of your academic background, you may not have been able to know that different women may have a need of a different sexual position to be able to achieve pregnancy, particularly when it becomes challenging. You can agree with me that in the recent time, the issue of infertility among couples in our society has transited from being a family burden now to society burden. Everything, so many couples coming down with the challenges of infertility. But for you to be able to understand the importance of sex position vis-a-vis your desire to achieve pregnancy, you need first of all to understand a woman's anatomy as it regards to their differences. Now, have a look at this. This is the anatomical presentation of a woman's reproductive system. And of course, for any woman to say that I'm fertility viable, it has to be in position to have the vagina. You also have what is called the uterus, the womb. It will also have the fallopian tubes and the ovaries. Now, these are very, very crucial factors, but our emphasis today will now has to do how does sex position now being able to contribute to the subject of achieving pregnancy. Yes, sex position is important because of what is called the positioning of the womb. That a womb can position backward, it can also on the normal state be able to project forward. We will be able today to understand this unique difference among women, that 20% of women have been seen to have retroverted womb or uterus. And for such women, getting pregnancy as normal may not be according to your own calculation. Be that as it may, whether the position is wonderful, right or wrong. Right position, yes, it should be very advantageous. However, for a woman to achieve pregnancy, that very woman must not have blocked fallopian tube, for sure. Because if the woman has blocked fallopian tube, irrespective of the amount of sperm that goes inside in the right position, she will not be able to achieve pregnancy. Okay, that woman must have what is called the normal womb. The womb of the woman must be good and normal. Let me have a look at this one. Right? If you look at this, this is the inside of a woman's womb with the aid of what is called hysteroscopy that gives you information about what's happening in the womb. If you look at this particular womb right now, you will realize that this woman's womb is fine, is clean. This cup-like area is where the baby usually attached. A woman with this type of womb should be able to achieve pregnancy with the right sexual position. You get that? And the second, let's look at another womb again. Now, have a look at this womb. If you see the inside of this womb is heavily infected. As a matter of fact, the integrity of the endometrium, the inside of this very womb, is condemned. And as in this particular case, it is not possible for this woman to achieve pregnancy. As a matter of fact, can only go for what is called surrogacy. Okay, if you also have a look at this, you can see this very womb, yes, is there, but can you have a look at a fibroid that is seated where the baby of this lady is supposed to stay? Also, irrespective of the sexual position being right, this particular woman will find it difficult to achieve pregnancy. As a matter of fact, even when the pregnancy occurs, the tendency of miscarriage could also be in a case like this. Okay, now let's have a look at this particular one. You can imagine that this very lady, the bone of abortion she did several years ago is still right inside the womb. Of course, you can understand that this very lady, irrespective of what you can put in there, right sperm quality, right sperm count, right sexual position, this woman cannot be in position to achieve pregnancy. And a lot more than this. Okay, This information is what the latest technology in the fertility evaluation of the women should be in position to give information about. All right. Now, looking more is the aspect of a man. Perfect sexual position. Perfect sexual position. A lot of semen sample poured inside the vagina. If the sperm count of that very man is not good, there is no room for pregnancy, because there is a criteria, there is a standard, there is a quality, there is a quantity of the sperm that is required for pregnancy to happen. So when it has to do with achieving pregnancy, very important that you as a man must understand that irrespective of your past, whatever you have done in the past and claim to have achieved, you need to subject yourself to your semen assessment. If you have low sperm count, if there be a case of blood fallopian tube, if there be a problem in the womb, all those things can now be summed up. Based on the understanding of this hysteroscopic report, in addition to other investigations your doctor should be able to do with respect to this fertility evaluation, then he could advise whether it's the issue of natural conception or the issue of you going for time intercourse following folliculometry, or he could be in position to advise you on what is called IUI, intrauterine insemination, or IVF, or the advanced technology of IVF that is called ICSI. And it's important for you to understand that when you worry about the issue of fertility, attention should be given to all these details as quickly as possible. Now, finally, let's be in position to look at what the importance of this very sex position is all about. For you to be able to have sexual intercourse that is aimed at achieving pregnancy, it is expected that the sperm should be deposited right there in front of the cervix. There are two types of uterus, or more or less womb, that you can find in women. Number one is what is called anteverted uterus. This type of uterus is common among women, all right? And then you have another type which is present in about 20% of women. It is called retroverted uterus. While the first one face front, okay, the second one, which is called retroverted uterus, face backward. And in the area of pregnancy-aimed sexual intercourse, it is expected that the sperm should be deposited in front of what is called the cervix. This very place that is called the cervix is the right place the sperm should be in front of it. Retroverted uterus, if you go by front, it may be, the woman may have painful sexual intercourse, but backward position gives the opportunity of the sperm to directly hit the front of the cervix in a woman of that particular condition. But how do you know the women that have retroverted uterus or have anteverted uterus? That comes to the aspect of what is called pelvic examination that should be done by your doctor. Based on your doctor's finding, he will be able to advise you based on all we have discussed in this video. Don't forget that You and Your Health is a program sponsored by Dr. Save a Life Foundation, and we're here to give you information, professional information that should be able to help you avert some health frustration right there in our society as a result of ignorance. We are coming up with a lot of mind-boggling information about your hair. Next, we will look at some of the misconceptions people do have about their sex life, and also about the issue has to do with premature ejaculation, the issue of penis size. How big will it be for you to have sexual satisfaction, and lot more. Watch out for more of our videos. You can also like our page, by so doing you can get information all for free on whatever we are doing. You can also visit our website right there on the screen. We have been able to assemble professionals from different parts of the world who are there online from time to time to answer you professionally. Your health is your life. Give it professional attention. I remain your friend, Dr. Richard Okoye. Share this video to all your loved ones. See you some other time.